If you've been taking Losartan together with Amlodipine for years, there is something critical you need to understand today.
The biggest danger isn't always the pill sitting in your hand. It's not knowing whether these two medicines are quietly protecting your vital organs or quietly warning you that your body's needs have changed.
After 5 years, that difference matters more than most seniors realize. Some people on this combination are walking around with steadier arteries, safer kidneys, and a far lower stroke risk.
But others are quietly living with swollen ankles, unexplained dizziness, altered lab values, or blood pressure that has drifted dangerously low without them noticing. Take Harold, for example. At 72, Harold's blood pressure had been stubborn for decades. One pill wasn't enough, but adding amlodipine to his Losartan finally brought his numbers down into the green zone. For the first few years, it felt like a miracle. No more pounding in his ears at night, no more dull morning headaches. But 5 years in, Harold sat down and asked a question millions of seniors face. "Doctor, what are these pills really doing to my body now? Am I safer, or am I just trading one problem for another?" Today, we are answering that exact question step by step. When you open your pill organizer every morning and see both Losartan and Amlodipine sitting side by side, it is completely normal to ask yourself a very sensible question. Why on earth do I need two separate blood pressure medications? Isn't one strong pill enough? It is a fair question. Many seniors assume that being put on two medications means their heart is failing or that their condition is twice as bad. But here is the comforting truth. Combining Losartan and Amlodipine is not a sign of defeat. It's actually one of the smartest, most calculated strategies modern medicine uses to protect your body with the gentlest touch possible. To understand why this combination works so well, imagine your circulatory system as the plumbing in a classic American suburban home. Over decades of living a full life, your pipes, your blood vessels, naturally lose some of their elasticity. They get stiffer, narrower, and less forgiving. If the pressure inside those pipes stays too high for too long, it puts a punishing strain on your main water pump, your heart, and damages the delicate appliances connected to the system, your brain, eyes, and kidneys. Now, if a plumber wanted to lower the dangerous pressure in your home's pipes, they wouldn't just turn one single valve until it snapped. They would make small, clever adjustments in two different places. That is precisely what your doctor is doing by pairing Losartan with Amlodipine. These two drugs do not perform the same job. They approach the problem from two completely different angles. First, let's look at Losartan. Losartan is what medical professionals call an ARB, or angiotensin II receptor blocker. In plain English, Losartan acts like a communication disruptor. Your body naturally produces a powerful chemical hormone called angiotensin II. When this hormone locks on to your blood vessels, it delivers a strict command: clamp down tight, hold on to extra salt, and keep the water weight. Losartan steps in like a shield, blocking that chemical signal from ever reaching your blood vessels. As a result, your chemical system calms down, telling your body it is safe to release unnecessary fluid and stop squeezing the arteries. Second, we have amlodipine. Amlodipine belongs to a family called calcium channel blockers, and it works directly on a physical level. For your blood vessel muscles to contract and tighten, they rely on small influxes of calcium. Amlodipine acts like a gentle velvet curtain, blocking excess calcium from entering the muscle cells lining your arterial walls. Without that extra calcium forcing them to tense up, the physical muscles in your arteries finally relax, widening the pathway for your blood to glide through effortlessly. One medicine interrupts the invisible chemical order to tighten, the other physically relaxes the muscle tissue itself. By attacking high blood pressure from both sides, your doctor achieves something remarkable. Instead of ramping up a single drug to a maximum harsh dosage, which often triggers severe, uncomfortable side effects, they use moderate, friendly doses of two complementary tools. Together, Losartan and Amlodipine ease the workload on your heart, protect the microscopic blood vessel filters in your kidneys, and shield your brain from the silent, cumulative stress that leads to strokes. It's teamwork at its absolute finest, keeping your circulation steady, silent, and secure for the years ahead.
Think back to the very first few weeks after your doctor handed you those prescriptions for Losartan and Amlodipine. If you were like most seniors, that initial adjustment period was probably a little confusing and maybe even a bit frustrating. When you start a new blood pressure combination, your body notices the change immediately, and it doesn't always thank you right away. In those early days, as your arteries suddenly relaxed and your blood pressure dropped from its old familiar highs, you might have felt a bit lightheaded when standing up from your favorite armchair. You might have felt a little washed out, unusually tired on your afternoon walk, or mild headaches as your circulation adapted to the new terrain. It is one of the strangest paradoxes in medicine. Early on, you often feel worse on blood pressure medication before you feel better. Why? Because your body loves familiarity, even when that familiarity is dangerous. If your vascular system spent 10 or 20 years pumping blood under high, stressful pressure, it treated that high pressure as its normal. When Losartan and Amlodipine stepped in to lower that force, your brain sent out mild alarm signals, mistaking a healthy drop in pressure for a sudden shortage. However, if you pushed through those early weeks under your doctor's watchful care, a quiet transition took place. Your body reset its thermostat, the dizziness faded, your energy stabilized, and your daily routine returned to normal. Now, jump forward to where you are today, 5 years down the road. This is where the true, invisible magic of long-term control lives. After 5 years on a well-matched combination of Losartan and Amlodipine, your body is enjoying what cardiologists call silent protection. It's called silent protection because, unlike a painkiller that noticeably stops a toothache or an antibiotic that clears up a fever, blood pressure medicine does its absolute best work without making a single sound. Nobody wakes up on a quiet Tuesday morning, pours a cup of coffee, and says, "Wow, my kidneys feel so protected today." Nobody steps out onto the front porch to check the mail and thinks, "My stroke risk feels wonderfully low this afternoon." That's precisely why so many people get tempted to stop taking their pills after a few years, because good health feels completely ordinary. But behind that ordinary, boring feeling is a massive, life-saving victory. For 5 solid years, every single minute of every day, your heart has been pumping against lower resistance. It hasn't had to strain itself to push blood through stiffened pipes, which helps prevent the heart muscle from thickening and weakening over time. For 5 years, the microscopic, paper-thin blood vessels in your brain have been spared from constant high-pressure pounding, vastly reducing your long-term risk of a vascular stroke or cognitive decline. And inside your kidneys, those delicate filtration plants that clean your blood, Losartan has acted like a protective shield, easing the internal pressure so those tiny filters don't get scarred and worn out. That's the hidden promise of reaching the 5-year mark. The real benefit isn't just a nice number on the digital screen at your local pharmacy.
It's the priceless gift of preserved independence, steady energy, and a safer future for the organs that keep you going every single day. While 5 years of consistent blood pressure control provides quiet, life-saving protection for your organs, there is another side to the story that we must address honestly. Over half a decade, a medication regimen that once felt completely seamless can slowly begin to reveal subtle side effects. These aren't always dramatic emergencies, rather they are creeping changes that quiet lives adapt around until quality of life is compromised. The most frequent complaint seniors voice after years on this combination centers on amlodipine and a condition called peripheral edema, or simply put, swollen ankles and feet. To understand why this happens, imagine a small neighborhood garden hose. Amlodipine works by dilating the small arteries bringing blood down into your lower legs. However, it does not dilate the tiny veins carrying that blood back up toward your heart at the exact same rate. This temporary imbalance creates a gentle buildup of fluid pressure in the lower extremities, forcing clear fluid to leak out into the surrounding tissues. By the end of the afternoon, especially in warm summer weather or after a long car ride, your socks leave deep indentations, your shoes feel tight, and your lower legs feel heavy like lead. While mild amlodipine swelling is usually more annoying than physically dangerous, its real risk is indirect. When your legs feel heavy and tired, you walk less, you skip your daily stroll through the neighborhood, you decline outings with grandchildren, and you spend more time sitting in your favorite recliner. Over years, moving less weakens leg muscles, compromises balance, and quietly increases your risk of a fall. The second issue that creeps up over 5 years is dizziness and lightheadedness. This often catches seniors off guard because they assume their blood pressure pills have suddenly gone bad. In reality, the exact opposite is often true. Your body may have gotten healthier. If you lost weight over the past few years, cut back on sodium, started walking more, or began sleeping better, your baseline blood pressure naturally dropped. But if your Losartan and Amlodipine doses remained untouched on autopilot, a combination that was perfectly tailored for your body at age 68 might now be way too strong at age 73. Standing up quickly from your bed or bending over in the garden can cause a sudden, momentary drop in brain blood flow, leaving you grabbing the doorway for balance. Finally, there is the silent, invisible factor, blood work changes. Because Losartan alters how your body processes fluids and minerals through the renin-angiotensin system, it directly influences your kidneys and potassium balance. Over time, your kidneys may hold on to extra potassium, leading to a condition called hyperkalemia. You cannot feel high potassium in its early stages. You won't wake up with a warning sign. Yet, elevated potassium can affect heart rhythms if left unchecked. Similarly, as kidney function naturally matures over 5 years, your body's ability to clear medications changes. This is why long-term use of Losartan and Amlodipine requires continuous partnership with your doctor. Swollen ankles, room-spinning dizziness, or altered lab values aren't signs that you should panic or stop your medication. They are simply your body's way of tapping you on the shoulder, whispering that it is time for a thoughtful medication review and a gentle adjustment. When you have been taking the same 2 blood pressure pills every morning for 5 long years, it is easy for rumors, internet myths, and well-meaning advice from neighbors to creep into your mind. Fear loves a vacuum, and when it comes to long-term medication, dangerous misunderstandings can spread fast. Today, we need to clear the air, shatter a major myth that causes unnecessary panic, and talk honestly about a few unexpected side effects you were likely never warned about. First, let's tackle the biggest myth floating around senior living communities and online forums, the build-up myth. Many people believe that if you take Losartan and Amlodipine for years, the chemicals quietly accumulate inside your liver, kidneys, or fat tissue, stacking up year after year like toxic bricks in a basement. People worry that after 5 years, their body is slowly being poisoned by residual medicine. Let us be completely clear. That is simply not how these medications work. Your body metabolizes and clears Losartan and Amlodipine on a daily basis through your liver and kidneys. They do not stack up inside you over the years. When a side effect appears after 5 years, it is almost never because medication built up in your bloodstream. It's because your body, your weight, your hydration, or your organ function naturally evolved around the medicine. The danger is not the pill sitting on your nightstand, it's staying on the exact same prescription for years without anyone checking if your body still needs that exact dose. However, while toxic buildup is a myth, there is a very real, shocking side effect of long-term amlodipine use that almost no one talks about: gingival hyperplasia, or gum overgrowth. Over several years, amlodipine can alter how calcium interacts with the connective tissue in your mouth. In some seniors, this causes the gums to become swollen, tender, unusually red, or even grow slightly over the teeth. Many seniors who experience this assume it is just poor brushing, old age, or bad genetics. They feel embarrassed, stop smiling as wide, or struggle during dental cleanings. If your dentist notices gradual gum tissue changes after years on amlodipine, do not ignore the connection. It's not an emergency, but it is a valid reason to consult your doctor about adjusting your regimen. Finally, we must address the critical difference between a minor nuisance and a true medical red flag. If you develop new or worsening chest pain, a racing or irregular heartbeat, severe sudden weakness, or trouble breathing, this is never something to brush off. You should never sit back and assume, "Oh, that's just my blood pressure pills settling in." Sudden cardiac or respiratory symptoms require immediate medical evaluation. At the same time, here's the most important warning of all. Never, under any circumstances, stop taking Losartan or amlodipine abruptly on your own because you got scared. Quitting blood pressure drugs cold turkey can cause a severe, sudden surge in arterial pressure, known as rebound hypertension. That sudden spike puts immense acute stress on your blood vessels, dramatically increasing your immediate risk of a heart attack or stroke. Understanding your medication shouldn't make you fearful, it should make you informed, empowered, and ready to protect your health safely. After taking Losartan and amlodipine together for 5 years, where do you go from here? The takeaway from everything we have covered today shouldn't be anxiety or fear. It should be awareness, confidence, and empowerment. Good medicine is never a static, set it and forget it decision. It is an ongoing, evolving partnership between you, your body, and your healthcare provider. The goal of blood pressure control is not just to celebrate pretty numbers on a screen. It is to protect your organs so you can live a full, independent, and vibrant life without feeling miserable. So if you are currently on this long-term combination, here's your practical, step-by-step 5-year action plan. First, commit to consistent home tracking, but measure trends, not moments. One of the biggest mistakes seniors make after years on medication is becoming either overly anxious or completely careless with home blood pressure cuffs. Checking your pressure 6 times a day and panicking over every single spike creates unnecessary stress, which ironically raises your blood pressure even higher. On the flip side, ignoring your cuff for 6 months and assuming everything is fine is equally risky. The safest path is middle ground. Check your blood pressure twice a day at consistent times, once in the morning before your pills, and once in the evening for 1 full week before your doctor's appointment. Record those numbers in a simple logbook. Your doctor doesn't need emotional snapshots. They need clear, long-term trends to see how your body is truly handling the medication. Second, insist on routine laboratory monitoring. You cannot feel your potassium levels shifting, and you cannot feel early changes in kidney filtration. Because losartan directly affects how your kidneys manage sodium, potassium, and fluid balance, routine blood work is essential. At least once a year or every 6 months, if you have underlying kidney concerns or diabetes, ask your doctor for a basic metabolic panel. Checking your serum potassium, creatinine, and eGFR ensures that the medicine protecting your heart isn't quietly straining your kidney filters. Third, be honest about your quality of life. If your home readings look absolutely perfect, say a textbook 118/74, but you feel constantly dizzy when gardening, too tired to go shopping, or embarrassed by heavy, swollen ankles, speak up. Never apologize for bringing up side effects. A treatment plan that looks brilliant on paper but shrinks your daily world is not a successful plan. Sometimes a tiny dose adjustment, shifting amlodipine to bedtime, or changing one component can eliminate side effects while keeping your numbers in the safe zone. Finally, never make sudden moves on your own. If you read something alarming online or hear a scary story from a friend, do not run to your medicine cabinet and skip doses or throw pills away. Quitting cold turkey can trigger dangerous rebound hypertension. Instead, bring your pill bottles, your home pressure logbook, and your questions straight to your primary care provider. Frame it simply. Doctor, I've been on Losartan and Amlodipine for 5 years now. My goal is to stay healthy and active. Can we review my labs, my current dosage, and see if this plan still fits the body I have today? That simple conversation transforms passive medication use into active, life-protecting care, ensuring the next 5 years are your safest, healthiest years yet.